Hello, everyone. This is a small review for your first exam. I will cover some of the topics on the exam. Still, this is not a comprehensive review. Please refer to your notes, books, and presentations while preparing for this exam. So before I start, I'd like to say that this is a course about all of us. We are getting older as we speak. In spite of that fact that this is still common from happening, ageism is a pretty common activity, and from philosophical point of view, it's quite self-destructive because we all are aging. So that said, we all will experience some changes when we age. These aging changes are not something abnormal. They are normal and expected, and they are part of the aging process. As much as we want it, we cannot turn back time unless you are an Oscar-winning performer and your name is Cher. So what are those changes? First and foremost, our physiological reserves will decline. And like you heard in a song, I ain't as good as I once was. And we live in Tennessee, so you all know this song. But everything will decline. So homeostatic mechanism will be affected. And anything related to blood, actually. Clotting times, red blood cell counts, white blood cell count decrease. With all that happening, some immune response decline is expected. While these changes are common, we should not expect the lab values to be abnormal in older adults. So think about lab values, and they are either normal or abnormal. If it's abnormal for everyone. Normal values are still applicable to older adults. These changes may affect the pharmacologic modalities, such as pharmacokinetics and pharmacodynamics. As an example of pharmacokinetic changes, let's look at the drug distribution. Drug distribution will be affected because of changes in hemodynamics, like I said, such as blood flow to the organs, and at the same time, drugs distributed in fat may have prolonged effect, and because of the changes in hemodynamics again, protein-bound drugs will stay in the system longer and may cause adverse reactions. So, in spite of gradual decline in function, people at older age still maintain high level of activity and, like we all like to do, may travel a lot. This may have some adverse outcomes. For instance, older travelers are more prone to injury than younger ones. Contrary to common belief, infectious disease such as influenza, malaria, traveler's diarrhea may affect the elderly roughly at the same rate as younger adults. So what do you do when you are dealing with someone who's sick and assessing them and it's an older adult? Accident or not, you may still decide to perform functional assessment. And remember that when you perform functional assessment, you observe the function. Basically, you need to ask the patient himself or herself to perform the function. You cannot rely on patient report or family member report, or on the other extreme, or the other extreme is when the entire physical exam is performed during a functional examination. Another topic I want to talk about is prevention, which is important in older adults. It's very important for you taking this course, differences between primary, secondary, and tertiary prevention. So primary, it's an easy one to remember and understand. Simply vaccination is a great example of this. Secondary prevention involves screening activities. So anything you use to screen, testing for occult blood in the stool, for example, you will screen for colon cancer. Or even something as simple as checking blood pressure when you see patient in the clinic, then it will be secondary type of prevention. Of course, we are talking about the patient who has no history of blood pressure, elevated blood pressure. So let's talk about tertiary prevention. This is the most complex to understand, but it's really simple on the other hand. It is actually the treatment of the symptoms or treatment of the disease. Think about it as a prevention, but prevention of a relapse. You are preventing the disease or the event from occurring again. Example, patient has a drug-eluting stent placed after a myocardial infarction. This may prevent relapse, hopefully, and help the patient to recover and maintain good quality of life. So to finish this video, I'd like to talk about health promotion, which is actually an example, and you all there talking with me and saying example of primary prevention, and you are correct. Anything you do to prevent the occurrence of the disease may be considered a health promotion activity. Again, good example is vaccination, exercise, stress management program. Example, if Silver Sneakers program for elderly at your local gym is initiated, it is a health promotion activity. And again, thank you for listening to this recording, and good luck on your first examination for this course.